Welcome, friends and neighbors. I'm really delighted to be able to come and speak to the community about all things COVID-19 vaccine related. I guess we wanted to just begin a bit with maybe what the current situation is like. So I'm very gratified to say that at Community Hospital, we started the morning with just one COVID patient in active isolation. We had a few more still hospitalized recovering, but certainly in the last couple of weeks, we've seen a really dramatic decline in the number of people with COVID-19 that's severe enough to require hospitalization. We've not had anyone in the ICU now for several days, so that's also been a very gratifying turn of events to see things really getting better. But we'll continue to talk about all those things that you can do to really protect yourself from being exposed and getting sick with this virus, because it's still out there. It's still circulating. And for those of you who follow the governor's guidelines and his blueprint, you will know that Monterey County is still considered to have widespread transmission of coronavirus. So we're still in that highest level, that highest tier of transmission. So as much as we say that, it looks like things are getting better, and they are getting better, they're not that much better yet that we can really back off on a lot of the things that we're doing to prevent transmission in the community. But one of the things we'll talk about tonight, one of the things that you can do to really protect yourself, protect your family, protect all of those who are near and dear to you, is to get the vaccine when it's your turn. So hopefully we'll go over a lot of the really basic questions about, is it safe? Who should get it? When can I get it? Where can I get it? What can I expect when I go for my COVID vaccine? So we'll go through a lot of those really key questions that people are having. And the thing that I said from the very beginning is that we were all going to have to be patient, that this was going to take a long time to get everybody fully vaccinated. But the good news on that is we keep getting encouraging reports from our local health department, from our state officials, and certainly from our federal government, that the distribution of the vaccine is really going to be ramping up. And we're all looking forward to some news in the next couple of days about having, hopefully, emergency authorization for a third type of COVID-19 vaccine. So all of that stuff is just boding very well for vaccination to really pick up in the coming weeks and months ahead. I'm just going to look to Monica and see, did you want me to say a little bit about the different rollout of who can get vaccinated and when?
Yes,
okay.
According to Monterey County Health
Perfect.
Department, yes.
So I guess I'll start with that, because probably by far, in a way, the most common question that we get is, when is it going to be my turn? When can I get it? Well, in the early days, with the supply being limited and obviously demand far outstretching the supply that we have, decisions had to be made about who was going to get to go first. Those decisions were not made by Montage Health. They weren't even made by our local county officials. These decisions were made on a national basis and have been revised numerous times. And so we are currently following the California Department of Public Health's guidelines regarding prioritization. So who gets to go first? Right now, we have opened it up for all healthcare providers. And the good news is we've really gotten through a large percentage of our county healthcare providers. We had about 3,000 Montage Health employees and healthcare providers already received both doses of the vaccine, and I can tell you a little bit about the outcome of that as we come up. So that's who's eligible now. Also eligible is anyone 75 years old or older. And the reason they picked that group is these are the people who are most likely to get very severe disease, be hospitalized, and unfortunately, that is the age group that's most susceptible to succumbing or dying from the virus. So that was a very high priority to prevent hospitalizations and death in our community. So 75 years and older, we're already open, we're already vaccinating those people. Now, already just a week ago, we started with people who are 65 and older as long as they had an additional qualifying factor, which was either they lived in a high-risk zip code or they worked in a high-risk industry, which included agriculture, childcare and education, or emergency services. So that's now 65 and older, but you have to have that second qualification based on your zip code or an occupation. And now, what we're moving to next, which will be next week on March 3rd, it's going to be open to an even larger group of people, which will be everyone 65 and older. And that would not need to have any of those additional qualifications, just 65 and older, you'd be eligible to make your appointment. And it would also open up to everyone in those higher risk industries, again, agriculture, education and childcare, and emergency services. So regardless of your age, if you work in those sectors after March 3rd, or beginning March 3rd, I should say, you would be eligible to sign up and get an appointment when vaccine is available. And then following that, an even larger group will be eligible for vaccination beginning on March 17th. And that will be everyone 16 and older who has a chronic medical condition or disability. So now that is going to be an interesting rollout, because that's a very large group of people. And I would urge everyone who's in these groups that are coming up to be eligible to start investigating now. Talk to your doctor. If you have a primary care provider, it would be very important for you to make contact with their office now, because there will be need to have some sort of letter or certification or document of some kind that you would fit into that group with a chronic medical condition or disability that would make you eligible. So it's never too soon to start planning ahead. So when those appointments are open to you on March 17th, that you would have everything necessary to prove your eligibility for the vaccination. Obviously, for the age-related eligibility, most places are just asking for a government-issued ID that has your date of birth on it. Or for example, if you're 65 and you've already signed up for Medicare, that would be something that would prove your eligibility, that you're 65 or older. So again, unfortunately, we don't have a lot of flexibility in these criteria at Montage Health. We're following the guidelines that are set forth by our county health department. And I would like to reassure everyone is that the county is moving together in sync. So other sites offering vaccine won't be able to get ahead of what we're doing at Montage Health. You can be more restrictive, but you can't be less restrictive than these guidelines that have been set out by the county. And everyone's doing their very best to be sure that we're prioritizing so that we get the vaccine to those most at risk first, because that will certainly help with decreasing the number of people who are getting sick and needing to be hospitalized. So we're going to try and not spend too much time taking questions about, when is it my turn? Again, we would refer you both to the montagehealth.org or chomp.org, where we have on our vaccine webpage some nice graphics and a lot of detailed information about how this is going to roll out. And of course, you can always look at the Monterey County Health Department COVID-19 vaccine webpage, which will also have the most up-to-date and detailed information about who gets in line and when. Okay.
Wonderful, thank you. So I'm going to just go ahead and start getting into some of the questions around side effects of COVID-19, because a lot of people ask those questions. So if you could just tell us first, what are the most common side effects that people experience?
Sure. I think a lot of people should really be familiar already with what it's like to get an annual flu shot. That's been going on for a long time. And so a lot of the side effects are very similar to annual flu vaccinations. So a large number of people will get a sore arm because it's an injection that goes into the muscle in your arm. And so usually people get a little pain at the site. And because you're getting something that's stimulating your immune system, it understandably can cause those same symptoms that happen when your immune system is activated. So people can get some body aches, they can get low-grade fevers. They can get kind of chills where they just feel like they can't get warm. So those just sort of general symptoms that your immune system has been activating and is starting to work. These symptoms are generally very mild. They last 1 to 2 days. They're usually completely resolved by 3 days after the vaccination. And they usually just don't require any medication, or if they're particularly uncomfortable taking over-the-counter medications like acetaminophen, Tylenol, or ibuprofen like Advil or Motrin is usually enough to make them go away. I can tell you that when I got my first shot, yeah, I got a lot of pain in the arm, and after the second shot, I had a lot of fatigue. That I didn't mention that, but fatigue was pretty common. People just felt really wiped out. So that being said, not everybody has side effects, not everybody has them to the same degree. And we have experienced, so this is a great thing I was telling you, we had nearly 3,000 of our healthcare workers at Montage Health get vaccinated. So we have a lot of experience about what happens when people get this vaccine. So the first thing I want to say is that we had no one with any serious side effects. I know everybody's worried about the most dangerous one, which would be anaphylaxis or a very serious allergic reaction that can be life-threatening. We had no one with that reaction. And even now that we've done, wow, she's going to give me the number? Okay, that we have done more than 15,000 vaccine doses. We still have not had anyone with that most serious side effect. But we've had a lot of people that, did get achy and feverish and chills. And, if you're prone to that, for example, if you say every time you get your flu shot that happens, it might be good to not make a lot of plans for, the day after you get your vaccine shot, so that you can prepare in advance and not feel like you're so wiped out and yet have to go and go to work or something like that. So we even gave that recommendation to our workers at Montage Health that, if you could arrange it before a day off, that might be the best thing, just to give yourself some time to recover and get your energy back before having to go back to work. Yeah, before we move on, I don't know that this was on those, but and I think another question I get a lot is, how is it even possible that we could get these vaccines so quickly? How do we know it's safe? That we say over and over again, it's really astounding how quickly they were developed. So yeah, it is true that the two vaccines that we're talking about, one's made by Pfizer, one's made by Moderna, they're the same kind of vaccine. For people who are interested in the details, they're called messenger RNA or mRNA vaccines. So they're very similar in how they work and how they were developed. And the same thing, they both require 2 doses. So in a lot of ways, they're very equivalent, and they have about the same amount of efficacy. One of these is not that much more effective than the other, and they're both highly effective. They both are 94, 95% effective at preventing severe disease, which is really about as good as a vaccine we've seen in a really long time. That's way better than our annual flu vaccines. But just because it was done quickly doesn't mean that it was rushed and safety or anything else was sacrificed. Their corners were not cut. They went through the same type of scientific research study to prove their safety and efficacy as any other vaccine that's made it through the FDA process. There were 70,000 people between the 2 vaccines that were in these research studies to show their safety and efficacy before they even came to the FDA. So I think instead of looking at it as, wow, that was too fast for us to really be convinced that they were safe and effective, it should be more, wow, we have new technology available to us. This is new vaccine technology that hasn't been used for any other viral infection before. So that was a really a great breakthrough. It wasn't rushed. The other thing I want to point out is, there were those 70,000 people who were in the research studies, but now we've had millions, literally millions of people receive these 2 vaccines across the country. And we continue to record safety data. So those of you who've been vaccinated will know that you can report your own side effects. So the CDC has a really convenient web app, and the FDA also has a website where you can directly report to the FDA and to the CDC what happened. You can tell them what you felt. Did you have fevers and chills? Did you have, body aches? Did you have to stay home from work? Did you have to go see your doctor because you had something that was concerning? So people are able to report directly all of those side effects. So I think that's reassuring to a lot of people too, that we have this direct reporting system. And the other good news about that is that now, with millions of people having received doses of these two vaccines, we haven't seen any surprises. We haven't seen anything new or different that we didn't see in those clinical trials. And the more people that get it, the number of those serious side effects, it actually is much lower than predicted. So I think, if anything, as we continue to roll this out, we're getting very reassuring follow-up safety data from, actual people who've been vaccinated and they weren't even participating in a clinical trial. So, we kind of got through it as we vaccinated our healthcare workers very quickly. So, there were a couple of days there where some people felt achy and, didn't feel up to coming to work, but that was a very small number of people, and the vast majority of people tolerated it without any significant side effect.
Wonderful, thank you. Now, you mentioned pain relief remedies. Do you recommend that people take any sort of pain relief before the shot? And then also there's been controversy around, whether Tylenol or ibuprofen should be used afterwards.
Right. That's a great question. So, a lot of people who are worried about, oh gosh, what if I'm prone to allergies, or what if I know in advance that I'm, one of those people that always gets, a fever after my flu shot. Should I just prepare in advance and take some Tylenol before I go? Or should I, take some Benadryl before I go? Well, the answer is no, it's not recommended that you try and prevent or preempt these symptoms, because we really just don't know what effect it may ultimately have on your response to the vaccine. Now, there has been the suggestion that if you take these kind of anti-inflammatory medications, it could suppress your immune system to the point that you don't have as strong a vaccine response. Now, we don't really have any evidence to say that's true. I think it's just more that it's not known, and it's probably safer. And so many people do just fine and don't need any medication whatsoever. It's probably better just to not take anything in advance, see what happens, and if you do start developing symptoms, then you could medicate as soon as you start feeling the slightest bit off. Go ahead, but don't try and preempt it. The other question we get is, oh, I have, arthritis in my knees, and my doctor told me to take Tylenol as a routine medication every day. Keep doing what your doctor says. Don't hold back on your medicines. Don't stop taking your medicines in anticipation of the vaccine. We wouldn't want anybody to have any setbacks with their chronic medical conditions because they're trying to prevent something which may not even happen. So, I think there is some results from studies done in children. And so this doesn't necessarily apply to adults. And I think that's why the CDC and the FDA has made a pretty clear statement. Don't take these medications in advance. We don't really know what effect it may have, but ultimately it's not felt to be harmful in any way. And of course, again, from the clinical trials, a lot of people had side effects, and a lot of people took these medications to medicate those side effects, and they still saw 95, 94% efficacy.
Thank you. So the next question is around medical conditions. What type of medical conditions would someone have that would make them ineligible for the shots?
Great. Yeah. A lot of people, especially since we're talking about the ones who are going to be eligible first, are the ones that do have chronic medical conditions. So people want to know, is there anyone in particular that would say, oh no, that's too high risk, you shouldn't get the shot? The bottom line is that the COVID vaccinations are really safe and appropriate for basically everyone. So people who have a cancer diagnosis, maybe getting chemotherapy, the recommendation is talk to your provider. You may not, because if your immune system is suppressed, you may not have as strong of an immune response, but that doesn't mean that it's unsafe to get it, and it doesn't mean that it wouldn't be beneficial to get it. We also get that for things like I take steroids chronically, or I take an injectable medication because I have rheumatoid arthritis or psoriatic arthritis. Same thing, you know, you're on medications that may suppress your immune response, but the likelihood is that you would still have a benefit. And we haven't seen anything to say that it would be more dangerous or risky for you to take it. So basically, all of those chronic medical conditions would not disqualify you. You should still take the vaccine, but have a conversation with your doctor about how it may affect ultimately the efficacy, because you still may want to be very cautious in how you protect yourself when you're out in public or with people outside your household, because you may not have as robust an immune response as somebody whose immune system is fully intact. There was something else I was going to say about chronic medical conditions.
Well, while you're
thinking about it, if I remember,
that, we did have a question come across about what if you're pregnant?
Oh, that was it. Chronic medical. Okay, that was it. It's not really a chronic condition. It's more of a temporary condition, but they did not study the vaccines in pregnant women in the clinical trials. So there's no direct safety information. I should tell you that now they are doing trials in pregnant women. But the American College of Gynecologists and Obstetricians did say that there was nothing to indicate that these would be harmful in pregnancy. And so again, what we do know is that COVID-19 in pregnancy does put the mother and the developing baby at risk for worse outcome or complications. So knowing that there is risk with the infection, but there was no proven risk with the vaccine, for most pregnant women, the recommendation is talk to your doctor, but it's felt to be more beneficial than harmful, although there's no specific data just yet, because we didn't study it in pregnant women. And again, I can go back to our experience, and I think that's helpful for a lot of people, because we went first. You know, it's kind of good to know, yes, we did it, you know, and we had really great outcomes. So we did have a lot of healthcare workers who were pregnant that did elect to take the vaccine. You know, they did the calculation for themselves to say, I think the risk of getting infected and having COVID-19 is much worse than the risk that may or may not be associated with the vaccine, because there was no direct evidence to say that it would be harmful in any way.
Great. So can then you also talk about those with allergies? Are there any types of allergies that would put someone at risk with the vaccine?
Right. Yeah, that's another big question is you know, what if I'm allergic? And certainly for people who've had a history of anaphylaxis, this was a big concern. People may be aware that even before we gave the vaccine here in the United States, it was given in the United Kingdom. And there were reports there of several people who did have this anaphylactic reaction or shock immediately after having received the vaccine, which led the United Kingdom to say, okay, if you had a history of anaphylaxis, maybe you should take some precautions. The CDC and the FDA reviewed all of that information from the UK and reviewed all of the information from the clinical trials here, and have recommended that if you have a history of anaphylaxis to a vaccine, any vaccine, or any injectable medication, so anything that's given with a needle, that you should proceed with caution. So it's not to say don't get the vaccine, but it's to stay for 30 minutes, be observed, and be sure that everything is okay for 30 minutes afterwards before leaving the vaccine center. The only people who should absolutely not get this are people who have anaphylaxis to any of the ingredients in the vaccine. So we have those ingredients posted on our frequently asked questions. The thing is that very few people would have been exposed necessarily to these ingredients because these vaccines are sort of a new creation, but it is some of the preservatives that are in the vaccine that was felt to be related to those severe allergic reactions. So that's where, again, if you've had a previous really severe allergic reaction like anaphylaxis, you should take a look at the list of ingredients, talk to your doctor, and make a plan for that. Now, if you're allergic to bee stings or latex or have food allergies, even if they're really severe, those would not require any particular additional precautions be taken because there's no evidence to say that those types of allergies have any impact on how you'll react to this vaccine. So we get that a lot. But yeah, so if you carry an EpiPen because you might get stung by a bee, that's not relevant to the COVID-19 vaccine.
Okay. Well, now I'm going to get into effectiveness.
Okay.
One of the questions that we got, and I've been asked this a lot myself, is once you get the vaccine, can you still get the virus and can you spread that to others?
Right. Great question is because everybody wants to know, if I'm vaccinated, am I safe? Can I go out and hang out with other vaccinated people, or can I dispense with the mask? And well, we don't know just yet. And again, we're waiting on more information to come out from the vaccine trials where they're doing follow-on studies, because we know this from other respiratory viruses, that we do know that even if you yourself are immune and protected and not going to get sick, it's still possible that you could be carrying the virus in your nose and mouth. Although you're not sick with it and have no symptoms whatsoever, you could still be contagious. And so that's the thing that we really are waiting on, some more information before we can tell people that they can dispense with the mask wearing and maintaining distance. So for right now, what we know about the vaccines is that they will protect you from getting sick. Both the Pfizer and Moderna vaccines are 94 to 95% effective of preventing moderate to severe COVID-19 disease. So that's the main driver, is that they'll prevent you from getting sick. We're hoping to see in the coming weeks and months ahead that not only will they prevent you from getting sick, but they would prevent you from carrying the virus and inadvertently exposing people around you. But until we know that information, even those of you who are fully vaccinated should continue to follow all of those same precautions by wearing a mask when you're in public, and around people that aren't from your own household. The CDC is expected to come out with some additional guidance for people who are vaccinated. They've already said one thing, which is that if you have been vaccinated and you get exposed to somebody who had COVID-19, typically we would tell you, you've been exposed, you need to go home, you need to quarantine for 10 days and monitor yourself for symptoms. But if you're vaccinated, they've now said you don't need to do that quarantine period for the first 3 months after you're vaccinated, because we know immunity lasts at least that long. So that's a big relief to, again, a lot of these people who work in these industry sectors that are essential. So that means that if you work in agriculture, child care or education or emergency services, if you've had an exposure, you no longer have to stay home from work. You can continue to go to work and do your essential work. So that's big news. The other thing too is they're going to probably also release some restrictions to say that it's okay for people who've all been vaccinated to be able to gather in small groups, that also appears to be safe. So we're hoping that, as the ball gets rolling and more people get vaccinated, we'll get more of that information, and these restrictions on our daily life will really begin to ease up even more in the weeks and months ahead.
Great. So we did get some questions about the variant, the other strains of the illness that's out there. Can you talk to how the vaccine does or does not protect against those new variants and why they should still get a vaccine?
Right, good question. So is big news these days, which is, just as we're thinking, hey, we've got a handle on this, we're going to vaccinate everybody. We're really coming to find out that there are new variants or new versions of the developed based on viruses from a year ago may be slightly less effective for these new variants. So that information is currently being generated by the scientists. They're currently out there checking the vaccine-generated immune responses against these new viral variants to see how effective the vaccines might still be. And at least one of the two mRNA vaccines, and forgive me, I can't remember which one it is right now. I believe it's Pfizer, has already published some follow-on data to say that it is still effective against these variants. So there's a couple of them that are out there that are really of concern. And the state health department is tracking very closely how frequently they're detecting those variants here in the state of California. And the good news is that the ones that appear like they could have some impact on vaccines don't appear to be circulating here in large numbers. But again, that's a situation that could change very quickly if we really don't continue to adhere to all of those measures that are aimed at stopping the spread of all of those variants. Also, people may be aware, like I said at the beginning, that there is a third vaccine that's in the very final stages, and we're expecting to hear some good news out of the FDA in the next 3 or 4 days. That one also has been tested against these variants coming out of Brazil and South Africa. So, and it does appear that it is that vaccine is still effective against those variants. So the bottom line is that it does look like the vaccines that we have now or will have in the coming days still offer protection. It may be slightly less than what we had expected with the strain that was circulating previously. But there's nothing there to suggest that getting these vaccines would not protect you from getting sick. So it's something that we're keeping a very close eye on. We're monitoring the spread in the community. So again, if you want to know if you should be worried about the variants, I would say just keep doing everything that we're supposed to be doing with wearing the masks in public when you're not around household members, maintaining your distance and minimizing large group gatherings. And we won't have to worry quite so much about those variants because we won't even give them the opportunity to come here and spread within the population.
And we just had this question come in. Can I choose which vaccine I get?
Oh, good question. Yeah, that's a big question on a lot of people's mind. So there, I don't even know how all of the different vaccine sites are operating. Our particular Montage Health vaccination sites will announce in advance which vaccine it is that's being offered at the particular clinic that you're signing up for. So you will know in that regard. Right now, the two vaccines that are available, the Moderna and the Pfizer mRNA vaccines, are so equivalent in most every way that we can think of that there would not really be a big advantage in choosing one over the other. So, technically, like I said, for the Montage Health sites, you can choose. Like if you go to sign up and it says it's the Moderna vaccine clinic, you could decide not to sign up for that and wait and take your chances to see if you could sign up for the Pfizer clinic. Me personally, I would just sign up for whichever one is first available, if it's available to take it. I know that there's a lot of concern that perhaps the Johnson & Johnson vaccine, that is the one that's the next one that we're expecting approval, may not look like it's as effective as the Pfizer and Moderna vaccines, but That one has a lot of advantages to it, and the biggest one is that it's a single dose, and a single dose appears to be 85% effective about preventing severe disease that would require hospitalization. And in the grand scheme of vaccines, 85% protection is a really very good vaccine. So again, we can sort of put this in perspective with maybe our annual flu shot that people are more familiar with. That can range in efficacy, from 40% in what we would call a bad year, up to, 70, 60, 70% for what would be a more typical year. And if we have a really good match and a great year, it's maybe 70, 80% effective. So putting it in perspective, I think that when people heard that these mRNA vaccines were, 94, 95% effective, may not really have realized that we were aiming for 50% efficacy. The FDA was willing to accept anything that was at least 50% effective at preventing disease. So the Johnson & Johnson, if it's 85% effective at preventing moderate to severe disease, that's really, I would also put that in a highly effective category. So the idea that it could be, as we say, one and done and not have to worry about getting back for a second dose or getting scheduled for a second dose, there's a big advantage to that. And there's a large number of populations where getting them vaccinated with a single dose is really desirable. So although it may look like there's some choice out there, I would say at this point, with the availability being so limited, first available is probably your best choice.
And we had a question come across about what day and time does CHOMP post appointments?
Oh, okay. So the appointments for these vaccine clinics are going to be posted at different times. And it all 100% depends on when we hear about the delivery. So there's a very sort of complicated distribution system about when we find out how many doses we're getting and when they're coming. And we've made a real effort to post as soon as possible the appointments, as soon as we know how many doses we're getting and when. So unfortunately, there's not like one set time where you could just say, oh, I'm going to go look every Monday morning at 8 a.m. to see what appointments are available. It's at this point, it's not that predictable. So the best thing is just kind of check regularly. And I do know that Montage Health has been sending messaging out to the community and to patients in the Montage Health system, alerting them to when those appointments may be coming open. So I would just say, keep a close eye, keep checking the Montage Health vaccine page, maybe make a group of friends together where you guys monitor it. And, I know we do that for a lot of things where, you could have different people checking at different times and then just alerting your whole group to say that those appointments are available. So unfortunately, right now, there's not really a great schedule that we can say, go there at this time, this day, and look for appointments.
And just to add to that, we hope to have a regular schedule for that once we know that we have a regular supply coming in. So stay tuned for that. And when we do know that schedule, we will be communicating that through our website and through our e-newsletter and with our community.
Yeah. Again, for those of you who may be following this story more closely, you may be aware that the state of California has contracted with a third-party administrator with Blue Shield to really sort of tighten up and organize the distribution of COVID-19 vaccine throughout the state. So with that coming online and with Blue Shield really transitioning to take over the reins in the whole distribution system, expect that changes are coming, and changes are coming for the better to make this far more predictable and schedulable so people will know how much and when. But that process is still being built, and we're still having that roll out. So just, again, stay tuned. Changes are coming, but hopefully everything will be more vaccines, more regular distribution, more predictable. That's where we're headed.
And one more question on that. I know that we were getting less vaccines in our county than other counties if you look at per capita. And now it seems like the multi-county health systems will be getting it after the counties. So do we expect more vaccines here?
Yes, is the short answer to that question. Yeah, again, a lot of people were putting a lot of thought into, what was the best way to get the most vaccine to the most people as quickly as possible. And, the first system that they tried was to actually give it to these healthcare systems that operated in multiple counties, thinking that these are the larger medical systems, that they would be able to very quickly get it out to their members more quickly. But we found out by doing it that way is it led to a not very equitable distribution of the vaccine, where there were definitely winners and losers, that there were more places getting more faster than others. Having seen how that worked, changes have been made at the state level so that that system of distribution, where they're giving it to those health systems that operate in multiple counties first, is no longer in effect, that they're now giving it to the counties first. So that will in turn mean that Monterey County will be getting a larger distribution of the vaccine heading into the future.
When can children get vaccinated?
Oh, children, yes. So children can get infected, and we've seen infants and babies who test positive and they have fevers and runny noses, so they can definitely get infected and they can definitely be symptomatic. But we don't have anyone under 16 currently eligible for vaccination. And that's because the clinical trials for the two vaccines that we have right now, Pfizer did their studies on people 16 and older, and Moderna did its studies on people 18 and older. And so those are the limits right now. Pfizer has started a study to include adolescents ages 12 to 15. Moderna similarly has done what they call a age de-escalation, which means they take their 18-year-olds and then they work backwards. Pfizer is expecting, they fully enrolled that study for 12 to 15-year-olds, so we would expect in a couple of months that they'll have the data to show the safety and efficacy in that age group. And so it's expected that by the fall, perhaps we'll have vaccine available for children who are in that age group. Now, younger than 12, it will be even longer before we get data. And this is simply the necessity of safety. Any clinical trials that involve children have to be performed to the highest ethical and safety standards. We don't really want to put our children at any undue risk in these studies. So that's why is until we can actually do the studies to prove that it's safe and effective in younger people, we're just going to have to be patient and wait for that data to come out. So I really don't expect children younger than 12 to be eligible for any type of vaccine at all in 2021. It'll probably be 2022 before we really get enough data to continue to vaccinate younger and younger children.
So if I received the Pfizer vaccine for the first dose, can I take the Moderna or a different type of vaccine for the second dose? And then can you also answer there was another question that was similar about why don't we just do one dose for everyone? So maybe those
yeah. Okay. So the mix and matching. Yeah. So the answer is no, you should not mix and match these vaccines. That if you start with Pfizer, you should get your second dose with Pfizer, and vice versa. If you start with Moderna, you should get your second dose with Moderna. There may be some very rare extenuating circumstances where someone can't get the same one the second time. But again, you can't, it's not recommended that you mix and match, and it's not recommended that you go outside the recommended time interval either. So right now they still say follow the vaccine schedule as closely as possible to what was done in the studies, because that's what we know is safe and effective. Now, there's another proposed strategy that was saying, well, you know, if these are so effective after 2 doses, well, wouldn't you be protected after just a single dose? And the answer is yes, you probably have, from the studies, it showed about 50% efficacy after a single dose. But we do know that that booster shot very rapidly gives you this very high degree of protective immunity. And especially if the other question about the variants is out there, and you know, I don't think we want to take any chances to say that we're going to go with something that might be less effective when already the variants may in fact decrease the efficacy of these vaccines. So right now we have not decided to go forward with the just single dose only approach. Now that's been used in other countries where the thought is let's quickly get a first dose into as many people as possible, and then we'll follow it up with the second dose. It may not be exactly on time. It may be delayed a month or two, but that may be better than nothing. Now, there's some sort of complicated mathematical modeling out there that can say whether or not it's better to rapidly give everyone a single dose, even though it's only partially effective, and follow it up when we have more vaccine, or should we get as many people fully protected, you know, with the 2 doses, even though it may be slower and a smaller group at first. So again, most of those studies would suggest that we should stick to the published schedule with the 2 doses given either 3 or 4 weeks apart, depending on which one, and don't mix and match the vaccine. But certainly if you have some extenuating circumstances, or if something happens between dose 1 and dose 2, definitely talk to your doctor or your vaccine provider about what to do about that and what modifications would be acceptable or what you should do. I do know from a couple of people where they can't get back to their second dose exactly on time. You know, of course, this is when we're vaccinating 75 and up. Unfortunately, some of them may have accidents or need to be hospitalized, so they can't get it on time. And the recommendation is get your second dose as soon as you can, even if it's not exactly on time. You do not need to restart from the beginning. Even if it was delayed, it's still 2 shots of these, and that's it, and then you're done.
If someone tested positive for COVID before this time frame, and they no longer have symptoms, except for maybe being tired or some mild symptoms, should they still get the vaccine?
Yeah, so people who have had COVID-19 and recovered should get the vaccine. Of course, we don't want you to get it while you're still recovering. You should get it when you're no longer contagious and you've been cleared from your isolation period. So don't go to a vaccine clinic if you're still supposed to be isolating and quarantining at home. But if you've recovered and it's been several weeks, you would be eligible to get the COVID-19 vaccine. Now, the CDC has said that they expect that natural immunity to the infection lasts at least 3 months. The studies now are showing it's probably 6 months or more. Quite honestly, it's probably even longer than that your natural immunity would be effective. But right now, we don't know. We simply don't know how durable, how long lasting, how robust is your natural immunity. So it's recommended that you get the vaccine in addition to whatever natural immunity you have. There doesn't seem to be any downside to getting the vaccine. Again, it doesn't seem to cause any more significant side effects or reactions in people who have been vaccinated, who have already had COVID-19. So they fall into that group with everyone else that it appears to be beneficial and not harmful. So once you're no longer contagious and your symptoms are improved and you're eligible, you should sign up and get the vaccine.
Can you test positive after being vaccinated?
Oh, good question. So an associated question too is, can I get COVID-19 from the vaccine? No, you can't get COVID-19, the infection from the vaccine. These vaccines do not contain the whole virus. They contain just one gene, one tiny part of the virus. It's the spike protein. It's the part of the virus that if you see all those pictures, it's the little thing that sticks out on the outside. So, so they don't contain the whole virus. You cannot get COVID-19 from the vaccine. You can get the side effects, which are just from your immune system, but they're not from the virus. Now, you would not test positive for COVID-19 from the vaccine if you are taking one of what we call the swab tests. So the one where they put the Q-tip in your nose and look for the virus itself. But if you did a blood test where they take a needle and draw blood from your arm, after you've been fully vaccinated, you will have antibodies that you can measure that would be reactive against COVID-19. That's the whole point of the vaccine. So after you've been vaccinated, you would be expected to, yes, have a positive blood test, but the test for the virus itself, the swab test or the PCR test or the antigen test, those would not be positive from the vaccine. Those are only positive if you're actually infected with the virus. So again, the vaccine's not 100% effective. It's 94, 95% effective. So if at some point you start getting symptoms of, fever, aches, dry cough, sore throat, loss of taste or smell, that's still suggestive that you could be infected and you should go get one of those virus tests with the swab. And if it's positive, then you're infected. So that test is still effective for determining that you're really infected. It would not be affected by your being vaccinated.
Will we need to be vaccinated every year or even more frequently?
Oh, that's a great question about, are we going to need annual boosters? Kind of, is this going to be like an annual flu shot? Or is it, this is the only one we're ever going to need, and then we'll be immune for the lifelong, like you would for something like a measles vaccine? The answer is we don't know yet. And certainly with everyone keeping a close eye on these developing variants, that would be the concern, is if the virus changes enough from year to year, or maybe over the span of a couple of years, would we have to retool the vaccine and then everybody get a booster? That's certainly a possibility. We'll just have to watch and wait and see what happens. Right now, I think most of the epidemiologists are wanting to see that we can get everybody vaccinated quickly enough or stop transmission of these variants fast enough so that they don't become really entrenched in the communities, and that we won't need to worry about them much longer. So this is kind of a race that we're in right now, which is, how fast can the virus mutate versus how fast can we get everybody to that level of herd immunity. If we can get everybody to that level of herd immunity before these variants can really take off, then we may not be talking about needing to get boosters. But if we don't win this race, and if the variants kind of get a foothold and continue to spread, then we may be in a situation where it's kind of there year to year and we need to get booster shots. So we'll just have to wait and see.
So if I had a strong reaction to the first dose, should I get the second dose?
Yeah, so a lot of people who had a more severe or strong reaction at the first dose are, a little reluctant maybe to go back and get the second dose a few weeks later. So what I can tell you is that not everybody who had a strong reaction the first time has a similar strong reaction the second time. And people who had mild reaction the first time had a pretty strong reaction the second time. So it's really, you can't predict what's going to happen with the second one based on what happened with the first one. And that's back to what I was saying. There's the suggestion that, oh, should I pre-medicate or should I try and take something in advance to prevent these side effects? The answer is no, because in many cases, people don't have the same type of reaction that they did with the first shot. So the only reaction where we would say absolutely don't get the second shot is if you had that most severe anaphylactic shock reaction. And this is something that occurs within the first 15 minutes of getting the vaccine. It's a very severe, life-threatening situation. And thankfully, we're seeing that this is happening, kind of on a 1 in a million type situation where it's pretty rare. We haven't had anybody here in Monterey County have that type of reaction. So in general, even if you felt pretty lousy after your first shot, you should go back and get your second shot and know that a week or two after you've completed the whole series with the 2 shots, that you will be fully immune and have that 94 to 95% protection that we're all looking forward to.
Will healthcare providers like doctors' offices get a supply of vaccine when people with specific conditions want to be vaccinated?
Yeah, so this is a good question. Ultimately, the idea was to make this vaccine available in the same way that other vaccines are available to people. So, at your pharmacy or at your doctor's office or at the clinic where you normally go for healthcare. So the answer in the short term right now is that because we're ramping up and we have a small amount of the vaccine and it's pretty limited, it's going to be limited to these larger distribution sites or these larger vaccine clinics like the ones that we're running at Montage, where we can do hundreds of people a day. And so in the short term, it's not going to be available in every single doctor's office. The other reason for that is it comes in these vials where you get 5 or 6 doses per vial, and you have to use it all right away. So, that's why you need to have 5 or 6 people lined up ready to go to get the shot at the same time. So maybe having it in a doctor's office where they only may have 1 or 2 people who need the vaccine in any given day, that would end up wasting doses. And so right now we want to be highly efficient in using every possible dose, not letting any doses go to waste. So in the short term, expect to see that it's going to continue to be these bigger scale operations where we can just maximize giving every single dose as quickly as possible.
Thank you, Dr. Blum. I know that we're out of time, but I wanted to give you one last opportunity to maybe share with people, if they're still on the fence, what would you still tell them if they were still trying to make up their mind about the vaccine?
Yeah, I think that there's still a lot of people that have a kind of a watch and wait approach. They want to see other people go first and see how it's gone. And I'd say right now we've had a lot of people who've already gotten it, and we just see that it's been safe. And our experience at community hospital, we live in the community too, so we had plenty of people that work at the hospital that had been exposed and gotten infected because of being with friends and family members. And I can tell you that after we had fully vaccinated our Montage Health workforce, the number of people who have had COVID has basically dropped to 0. And we've also seen that people who have symptoms suggestive of COVID has also precipitously dropped off, like very few people with any signs or symptoms to suggest COVID-19. So I can say from our experience, it does really appear to have been safe and effective for our healthcare workforce, and that's been really a great thing. And not even just as a doctor, but as a mom, the things that you could do to protect your family and the things you could do to protect your loved ones. This is something that to me seemed to be a no-brainer. It's safe and effective, and we're getting to the point where we have more people vaccinated than have been diagnosed with COVID-19. And so, hopefully we'll all continue to work in that direction to keep everybody healthy and safe. But it really is one of the most important things that you could do is to get this vaccine when it's your turn, and be reassured that so far from everything we've seen, it's been safe and effective, just like we had expected.
Thank you so much, Dr. Blum. And if we did not get to your question, we apologize as we ran out of time, but we do have a lot of information on chomp.org/coronavirus and chomp.org/vaccine. And we also have links there to the Monterey County Health Department page that also has a wealth of information. Thank you so much for joining us tonight.
Thanks for joining.